This meeting is being recorded.
Okay, Shiva, introduce yourself. Master Fong.
Okay, thank you very much. I am Sifu Bryant Fong. I am the head coach for University of California's Cal Wushu and Cal Tai Chi teams. I also teach at City College of San Francisco, their health and wellness program. And of course, my subject is Tai Chi. I was trained both in China and here, and I studied under Grandmaster Feng Jiqiang, Grandmaster Chen Xiaowang, and many, many others, including Grandmaster Zhou Dayan, who is Bagua. So I am accomplished in both Bagua, Tai Chi, and Xingyi. And my interest is in developing these arts, not so much for competition purpose, but also for the purpose of health and wellness and for healing. So that's one of the goals of our program at the University of California. So, what I'm going to do today is talk about Tai Chi a little bit and a little bit about why I'm using the method I'm using, because it's kind of important to understand. So, let me just step aside for a minute from what you may or may not know. So, you are welcome to ask questions at the end. But basically, if you can understand, I have performed Tai Chi, competed in the worlds, all those things I've done, but trying to search for Tai Chi is not quite so simple because the method that we're using only teaches the outside movement. That's number one. Number two, if you hadn't realized it, we're teaching Tai Chi as a exercise and performance art, not as a way of healing. And so even I know acupuncturists that had to learn Yang 24. That's not actually Tai Chi. It's designed for performance. It actually has a lot of things that are incorrect about it and are actually don't help you learn to become more fit or in fact follow principles of Tai Chi. But okay, that's another aside. Okay, so as of this moment, the only style of Tai Chi recognized by the CDC is Sun Style Tai Chi because it has a clinical track record and all the movements are evidence-based. They have been curated and tested. And so everyone else can say that they can do it, but they have no data to show that that is true. We do know from Dr. Paul Lam, who created the study. He spent 15 years in his clinic in Australia uh, teaching different styles of Tai Chi, including Chen Yang Wu and Yang and Sun Style. And he found that Sun Style works actually the best. It doesn't put a heavy load on the body and emphasizes on learning to move the energy. Now, that I think is the key part. Most of our Tai Chi practice is all external, meaning I teach you how to do the posture, how to move your body. Never do we talk about how to move the energy. It's moving the energy that allows your body to heal. So today I'm going to try and talk a little bit more about Tai Chi and actually what kind of movements can you use. So this is for the purpose of clinical use, meaning those of you who are acupuncture doctors, these are things that you should be aware of that you can use. So first of all, there are 5 basic principles of Tai Chi. Tai Chi must have opening and closing,
Hello,
must have yin
Alvin.
and yang, must have inside and outside connection, must have fast and slow, okay? Um, must be, I should
To
say,
my
soft and hard, okay? So
what
all
we
those things must be part of Tai Chi, okay? Without
one
all 5 parts, you're
one
not doing actually Tai Chi. So most people nowadays doing Tai Chi can do the soft, slow motion. That's only a small part of Tai Chi. Tai Chi also, as I said, has to have opening and closing. And you also have to teach what? To listen to their own energy. It is that part that allows for the healing to occur. So we're going to learn today a little bit about Song, how to Song. Also some exercises that you can use for your patients to help them to learn to relax and also learn to breathe properly. So breathing properly is probably the most important thing. So for the first one, you can try it with me. It's easy to do. And I'll have Jack lead it in a moment. So you're going to place a hand on your chest, hand on your stomach. As you breathe, try and breathe with your diaphragm. Inflate your stomach and then release. And then breathe in again, using only your stomach. So now, of course, you realize when I say that. So in the classics, it says qi chang dan tian, and everyone thinks you're supposed to breathe down into the dantian. Actually, you don't. You push your diaphragm down, which pushes the stomach out. Okay, but it's the diaphragm that's actually expanding. You can't actually breathe through your dantian. That's impossible. There's no connection there. Okay, physically, that's impossible. And by dantian, we mean what? The lower abdomen of your body. So that is the tian, the field. The dan is your point in the middle, the acupuncture point. That is true, but you can't actually do anything to affect that point directly. Okay, so here you're trying to just use your breath to inflate the lower lungs. Now, again, why is this important? It allows you to breathe more deeply into your body, and that in itself is a healing exercise. So try about 8 breaths as we're standing here. So I'm going to have Jack lead you through that. Jack, let's do just 8 breaths.
All right. Sounds good. So we're just going to go into the 8 breaths. Make sure that pin is not. There we go. And so you're just going to go ahead and breathe in to your lower lungs and breathe out. Breathe in, expanding your stomach, feeling it fill up, and exhale. Ideally, we'll keep it going. Ideally, your inhales and exhales should take about the same amount of time. But everyone's diaphragm muscles start in different places, so one may be faster or slower. But the goal is to develop your breathing, have it nice and even. And we'll do 2 more. Breathe in and out. And last one. And exhale.
Thank you, Jack.
All right.
So that exercise does several things. First of all, as I said, it will increase your lung capacity. Most people, and especially if you're the seniors that you're treating, they will have very shallow breathing. Most adults can only use 40% of their lungs, okay? But 60% of it, they're not using at all. Here, we're beginning to retrain your breathing so you can breathe lower, okay, and deeper. Because you can activate more of your lungs, you're able to increase red blood cell count inside your body. So it also helps with what? Healing of the body. So this is a very important breath. And keep in mind, if you do yoga, for instance, it's the same kind of breath. So it's for the same thing, for your help your body to heal. Okay, so the next exercise is also a Qigong exercise that try and teach you and teach the student or the patient how to relax. So oftentimes you say, oh, relax. And they go, I'm relaxed. Actually, you're not. So how are we going to do it? So we're going to do a simple exercise, but how I'm going to do it is kind of important. So I'm not going to talk too much about all the mechanisms, but for now, you kind of sit in what we call the lower Jianzhang position. Your hand is on top of each other. I want you to hollow your chest, round your knees, okay? So your body is slightly curved up and down, okay? Head slightly bent forward. And now you push into the ground. As you push into the ground, try and connect to your arms. Feel your arms expand outward. And now from here, relax from your shoulder, elbow, wrists, fingers, hips, knees, foot. Allow the hands to relax. You'll come back together again to the initial position. Push into the ground again. Slowly bring it up. Separate. So roll your hands, separate, reach all the way out. Slowly relax, bit by bit. So now you actually actively must think about it bit by bit. From here, I think about relaxing fingers, arm, wrists, elbows, shoulders. And now I relax the upper torso, relax my hips and knees, and then finally all the way down to the bottom of my foot so that you can feel the connection, bringing your arms together. Then push up from the ground, bring the hands up. So notice it comes up. I'm not trying to lift it up. I'm pushing up. The arms are coming up, and then I separate. And then now relax, sinking back down. All right, let's follow Jack. So we're going to go through the physical part of it, and then you can try and see if you can feel the internal part of it. All right, let's follow Jack.
All right. So again, we're starting with our hands around our belt line, one hand on top of the other. And I'm going to push into the ground, see if I can transfer that force into my hands so they just float up without really raising my shoulders. Open up and let my hands float down carefully. Yeah, pushing into the ground, raise up, expanding, and coming back down. Especially when you're lifting, you want to keep your shoulders low. When you're opening up your hands, keeping it nice and relaxed. Everything should feel very smooth. If you're getting like jerky motions, trying to move slow, that's fairly common. If you need to work on relaxing specific muscle groups. And we'll do two more. Do push up, opening up the chest, come back down, hollowing the chest, rounding the back. And last one, opening up, floating down, and closing. Good.
All right, thank you, Jack. So opening and closing, as I said, is one of the main fundamental parts of Tai Chi. All Tai Chi must have opening and closing. And so the movement we did, this is the closing, here's the opening. By opening and closing, you're able to draw the Qi in toward you and you can feel it. Now that's important for the patient. If you don't feel any result from it, why would you practice it? Okay. So these exercises that we're introducing are designed to help the patient actually feel something so they can feel the energy and the process of healing. So they want to practice it more. The problem is if you introduce a whole bunch of complicated movements and they can't feel anything, there's no reason to continue to practice it. So that's part of the reason I am introducing it this way this time. So we're going to play with some more opening and closing. Now, so that was opening and closing with your arm. You're using the same process, but this time I'm going to open and close using my elbows. So how do we do that? So here, I'm closed. So again, my chest is hollow, back is rounded, knees are rounded. I bring it up, I open, and now watch closely. I then slowly close my hands together, and my chest is now hollow and rounded. And now I straighten, opening up the chest again and slowly closing. So this is good, of course, for upper body coordination, loosening the shoulders, stretching out the back. Okay, so it achieves many different things at the same time. So these are called the double elbow spirals. And let's follow Jack in practicing that.
Double elbow spirals. So again, we'll start with our hands in front of us and very loose fists. And so there's still like a hole. And shoulders down as always. Gonna push into the ground, come up and open, circle, and come back in. Push into the ground to open up and come back in. Much like in the previous exercise, we are opening up the chest and then hollowing the chest. You may also notice my arms, forearms rotating outwards and back inwards as part of putting various motions together in the same exercise. And practicing linking the body together to be able to achieve many motions from the same intent. And we'll do 2 more. You can link your breathing to it, last one, but it's not necessary. All right.
Now, it's important to wonder, you might ask, well, how's that different from just doing this? Well, when you're just doing this, you're engaging your muscles. The body cannot relax. And because the body is not relaxed, you may feel physically like you're loosening something. You're actually making it harder to actually relax because the very act of tightening your muscles causes even more contusion, or if you like, it actually creates blockages for your qi. So when you're doing this, you're using the minimum amount of force. There is no force being used here. I'm not using my muscles. That distinguishes it very clearly. So one needs to explain that to patients as well as students that I'm not using muscle to do this. If I'm using muscle to do that, then it's just regular physical exercise. I'm using no muscle to do this. What am I using? My body opening and closing. It facilitates the movement of my arms without having to necessarily engage my arms. So that's kind of a interesting exercise, okay? So that's good for, again, for the shoulders. So actually what I'm going to be doing is you're going to be learning different tools that you can use with patients. So that loosens up the upper body, stretches it out. These are all generally good for everyone, okay? They're not going to get hurt doing it, but the doing it will improve their circulation. So improvement circulation, pain goes away. So that's, quite important to do. So now we're going to go to another variation of opening and closing. So here, this is from our Sun style Tai Chi. So this is also called Kai He. Okay. So you breathe in, you open, breathe out, you close. Now, important to understand, I'm not moving my arms. My arms respond to my breathing. As I fill my lungs, it expands. As I exhale, it closes. I'm not doing anything physical. This is just my breath. It's also why it's moving so slow. So you can see me breathe in. Now I'm going to exhale. And again, same thing. I hollow the chest, round the back, hollow the knees. So that the entire body is expanding and closing at the same time. This allows you to pump the energy from your legs up to the rest of your body. Okay. And that's how you improve the overall body circulation as you practice this. So let's follow Jack doing opening and closing. This is called Kai He Gong.
Opening, closing. Tai He Gong.
如
Start with our
规
hands
避，对呀、
under our chin.
天麻，
Sorry. And we'll go ahead and open, inhaling, and close. Open, filling your lungs, expanding the chest, and close. rounding the chest, expanding the back. And keeping it going. Again, make sure your shoulders are nice and low. See if you can relax your core and your legs down such that you can have some of your body pushing into the ground and using that power to help pump the opening and closing, much like in the previous exercises. But the general main power is coming from your breath. Make sure your hands and wrists are staying nice and relaxed. And we'll do 2 more. Breathe in, open up. Breathe out, and close. And last one, open and close. Good. That's Taiji and Qigong.
Again, as I've said previously, it's not important, especially if you're working with patients, to teach them a whole form. A whole form originally, if you didn't understand, the original form is designed to what? Is designed to be used as a martial art encyclopedia for martial arts to catalog techniques, okay? But for the purpose of health and wellness, you do not need a form. In fact, it should be simple and easy for the patient to understand and something that gives direct results. So the movements I'm showing you today have been tested already in Paul Lamb's studies. So he's curated certain movements that are designed to improve and help the student learn how to move their qi. So the next one I'm going to do is going to make you more aware of your legs. Okay. So in Qigong practice, the legs are considered the second heart. And so if you didn't realize, your heart pumps the blood out, it goes into your feet. How do you get it back up? Well, in Tai Chi Qigong, what we do is we bend the knees and we straighten the knees. That engages the muscles in your legs and pumps the blood back to your heart. One of my students for his MA thesis actually studied that, and we found that we could increase the force in which the heart pumps. So actually the efficiency of your circulation system improves just by learning how to do this. So this again is a key part of all Tai Chi, but oftentimes people just step through it and don't consider the importance of the legs. So this is called carry tiger to the mountain. So again, your feet are shoulder width apart. Hand starts in the bottom position. So this is a lower meditation position, but you're going to draw the energy up from the ground. As you bring the hands up, you bend your knees. So you notice I'm sinking down, okay? So I'm drawing up, the hands separate, and I'm going to push into the ground because my knees are bent. I engage my legs and I push forward, okay? Then I reach out, I draw the chi back, bending my knees. Again, chest hollow, back round. We're doing the same thing throughout all these exercises, and now my body straightens. And if you did it correctly, you can feel the energy suddenly separate and go up and down. So in the Tai Chi classics, we call this Zhongding. Zhongding meaning what? Central equilibrium. When your body reaches equilibrium, the chi is able to separate, and you can feel it flowing upward and downward. This is very important. Again, I cannot emphasize the importance of engaging the body correctly with your breath and your mind, facilitate the movement of the energy and your blood. Okay, that's how Tai Chi heals. Without that process, just doing movements won't do anything for you. You have to do it correctly. And so in instructing patients, you need to make sure that you engage the legs. Okay, so again, this practice, we're going to work on engaging the legs. So as my arms come up, I engage my legs. As I push into the ground, you can feel the energy now come forward. Edge of your hands is forward. And now draw the chi back and sink it back down into the ground. All right, let's follow Jack. We're going to do it 9 times. So this is carry tiger to the mountain.
Carry tiger to the mountain. And we'll start in our lower Jianzhong position. So hands down at the waist level. And draw your hands up. And your body sinks down. Rotate your hands so that your palms are diagonal forward. And then push forward, extending your body and raising back up. Follow through and draw back in, sinking the body back down. Rotate the hands to pushing down and push down while standing back up. And again, sinking and raising the hands, raising the body, pushing forwards. Follow through, drawing back in and sinking the body, pushing down and raising the body. Again, keep everything nice and relaxed and smooth, and see if you can feel the connection all the way from your fingertips through your body and back down into the ground. So when I sink, I'm drawing up from the ground. And when I extend, I'm pushing off the ground. Of course, this is one of the moves where the martial origin is a little bit more obvious. But instead of feeling like a muscular, muscle-based push forward, there should still be an element of sinking to it. Just relaxation. And we'll do two more. And last one. Draw up to the chest. Rotate your hands diagonally forward. Push forward. Follow through. Draw back in. Push down and raise up. Good. And that's return tiger to mountain.
Okay, another set of exercises that you can also introduce in addition to these come from my teacher's Fong Sung Gong practice. So Fong Sung Gong, you need, of course, to relax in order to do it. Purpose, again, is to feel the qi. And again, a patient will not, or just anybody, will not continue to practice if they cannot feel any tangible results. And we were talking about that at lunch, that why is yoga more popular than Tai Chi? Because it's very hard to feel the effects of Tai Chi. So if you cannot song, you cannot do it. That's number one. Number two, however, is the method in which you teach it. If you don't teach the proper mechanisms, people, as they're doing it, won't get any result from it. So it is important to understand the two things that I've been emphasizing so far. One, you have to open and close. And also you notice I open and close, I stand up. When I close, I open the bottom, I relax, okay? So the body is doing this, okay? The other thing is I have to do a push into the ground to come up. And as I song, I sink into the ground, okay? The ground provides me with the energy so I can begin to feel the movement of the energy inside my body. So those are important to understand. Everything we do today will utilize those parts, okay, or those principles, and then we're illustrating them in different ways, okay. Most of these are good for general health, number one. Number two, however, so this the ones we've dealt with so far. circulation problem, this helps, okay? You have blood pressure, high blood pressure, this will help. The movement of your knees up and down will help you with diabetes. So all these things are exercises that can help a patient. The other thing is these exercises like the shoulder loosening and elbow will help with circulation, but also with if they have energy stuck here, they're stiff, they have pain. By opening up the joint and being able to allow the chi to move, their healing process will be much better. So I tell my own students that the Tai Chi is a supplement, your massage and your acupuncture that you get from your doctor. And because you continue to open up, the process of healing moves faster. You don't do anything, after a while, you become stiff again, it stops the circulation, and it starts hurting again. So by practicing these movements, they begin to understand this is a way to keep the circulation moving and to actually make the healing process occur. All right, so I'm going to move on to something else. So this one is for your wrists. Yeah. So this one, however, it's going to be hard to explain. So you notice how my shoulders, elbows, wrists. It's kind of like taking something and throwing it out with the back of my hand. I'm trying to relax the entire body. So I sink first, and then now I push it out as my body straightens. Okay. So again, you bring it in, my body's up, and then I push into the ground and drive my hands forward. So you notice how the arms rotate and the shoulders. I'm also at the same time engaging my knee, hollowing of the chest. So as the chest straightens, I connect the top to the bottom, allow the chi to separate. Okay. All right, so let's follow Jack now. This is revolving the arms.
All right, revolving the arms. We'll start with both hands face up in front of us. Draw in towards your chest. And hands stay face up. Come around the inside and rotate as they come to the front. Again, draw in and rotate to the front. It's a very important exercise not to raise your shoulders in, because it's very easy, especially when you come in and try to have your arms in, to try and raise your shoulders. You keep it nice and smooth all the way around. Draw in and pump your arms around, pumping from the feet. Wrists stay nice and relaxed so they can freely rotate. And elbows stay nice and relaxed as well. See if you can feel it sinking in all the way from your fingers to the ground, and then coming up from the ground. And we'll do 2 more. Sink into the ground, push off the ground, just swing your arms around. And last one. Good.
So again, let me just explain a little bit of what's going on. So many of you may not have read any of this. Dr. C.P. Ong wrote a paper on the role of fascia and Tai Chi. So fascia, we know, are little tissues that are all over your body. For a long time, modern science could not figure out what is the role of fascia. So if you ever cut open a chicken, that yellow stringy stuff inside, that's the fascia, okay? It's all over your body, connects to all your organs everywhere. So the movements in Tai Chi are circular and spiraling because we're trying to get your fascia to knit together. When the fascia knits together, we believe that the meridians and channels run through the fascia, and that's why the Qi can be transferred easily forward. When you just do straight movements, the fascia will not connect easily. In fact, you may just pull it apart. By circulating it, you knit it together, it becomes very strong and very connected. So a lot of the movements in Tai Chi are always spiraling and circulating for that reason. So the movements aren't straight, for instance, right? You're not doing this. The movement has to be circular and rounded each time so that the fascia has a chance to knit. Okay. There's also been some recent discoveries in Japan where they did research on how the fascia can actually help the patient recover. And so they did it artificially, meaning they tried to connect the fascia using ultrasound and an injection of liquid into the fascia itself. And they found that as soon as they did that, the person could heal almost immediately. So that's kind of surprising. So the conclusion was that Tai Chi and yoga work on this principle of knitting the fascia together, allowing the energy and liquids to move through your body. Because when they can do that, the muscles, instead of sticking to each other, have a liquid between them. They're able to slide around each other effortlessly and smoothness. And so their circulation improves rapidly. So all the movements I'm introducing today spiral in one way or another. So the next one we're going to do is also, again, we're going to make use of the ground force. So we start here. So as you go out, you're bending your knees, bring the hands to your side. Again, push off the ground, push the hands forward. And now here, sink. So here you're opening. And again, you're closing. So chest is rounded, chest is hollow, back is rounded, knees are bent. As I come out, the whole body is straightened. So now I'm up and down. Again, allows the chi to separate. This is my Zhongding posture. And now I sink again. Try and drop your energy, drop your feeling to the bottom of the ground, to the ground itself. Push off the ground and push forward. So this is called Big Bear Swims in the Ocean. So again, let us follow Jack.
Big bear swims in the ocean. I'm going to start with my arms out in front of me, palms up, rotate the palms down, separate, hands come around. So when I fully close, my hands are palm up at my waist. I push up from the ground and present my hands forward. And again, rotate, separate, sink, and present forward. It is a lot like a brushstroke sort of stroke. And you can see the parallels to the previous exercise. Pushing up, staying nice and connected all the way to the ground. And keeping everything feeling nice and light. So you don't want to be like really pushing through syrup. You're swimming just through lake. Very light motion of the hands. Good. We'll do two more. Separate and raise and present forward. Last one. Sink and raise. Good. And that's Big Bear swims in the lake.
Okay. So another one of the principles of Tai Chi I mentioned earlier is that every movement has to have yin and yang. So in the Tai Chi Classic, it talks about yin yang is the result of what? Nei wai zhe he, meaning that the inside and outside are connected. Meaning that what I do outside influences what happens inside the body. So we are going to do several different versions of Dai Mai Mo Pan Gong. Dai Mai, as you realize, is the belt meridian, which controls your guardian qi or your wei qi. That's number one. Number two, it also is connected to your kidneys. So the qi goes around your waist, also nourishes the kidneys at the same time. Kidneys are important for life's qi. So important for general health and also for longevity. So when my teacher taught Qigong, every set of Qigong I learned from him has some version of this move. So I'm going to introduce several different ones today. Okay. So the simplest one, let me move back a little bit so you can see. Okay. Think of a big barrel in front of you. I'm going to touch the barrel with my fingers. Okay. Now, it's important to not just do this. Move your arms. So you notice this is moving my arms. I'm actually not exactly doing that. My body turns, my arms follow. Okay. And so you must do this precisely. So in Tai Chi, the other thing that's important, when one part of the body moves, everything must move. Otherwise, the Qi cannot circulate throughout the body. So the hands are about at the height of your lower abs. Okay. So this is Dai Mai Mo Pan Gong. Let's follow Jack.
Dai Mai Mo Pao Gong. And so we'll be doing this in two directions. So I'm going to start going clockwise as viewed from the top. So my hands stay face down. Again, like you're touching the rim of a barrel. So you can feel your body expanding as you go out and contracting as you draw back into the center. See if you can get good sensitivity in your palms, almost as if you can feel yourself touching the barrel. And we'll do two more in this direction. Good. And to balance things out, we'll go in the other direction. Again, you're turning at the waist. So your legs are moving very little. Your legs and hips should be moving very little. Most of the motion is coming from the waist. Your arms relative to your body, mostly just going in and out slightly, not really left and right. That's all coming from the body itself. And we'll do two more. So expand out, come around, draw back in, and rotate back to center. And last one. Good. And that's Dai Mai Mo Pao Gong.
Very good, Jack. So one thing to remember when you're teaching this or just practicing it, as you're turning, you should not feel your knees turn. Okay. If your knees turn, think about a table's legs turning, the table will eventually collapse. So that's bad for your knees. That leads to what we call the Tai Chi knee. And that's because the knee moves too much, you end up loosening the knees. Okay, which is one of the things that is bad about Yang 24. It teaches you to do it incorrectly, allowing you to rotate your knees, which can lead to actually loosening your patient's knees. So that's why 24 is not actually correct. It's correct superficially, okay? But when you talk about internally and the way the body works, it actually is wrong. So it's okay if you want to talk to me about it and you teach 24, I'll be glad to explain to you some of the problems with that style. Again, it was not created as a medical teaching form, okay? It's for competition. All right, so remember, don't move the knees when you're doing this. So now the next one is much bigger in movement. It's also Dai Mai Mo Pan Gong, but on a much bigger level. So the theory is the outside is yang, and I'm moving my energy this way. As I do that, the inside energy follows in the same way. So the outside yang leads the inside yin. So the two combine to move energy inside and outside. So again, real Tai Chi has that built into its movements, and how should I say, it should be easy to do and not complicated. So problem sometimes with something like Chen style is so complicated that you don't know what's inside and outside. When what we're doing is quite simple, easy for anyone to kind of learn those basic concepts. So again, for this one, we're going to start actually up here, and the fingers are facing each other. About the height of your tanjong, the heart point, okay, is about right. So you're going to turn, and again, don't turn your knees. And now you can't go any farther. You bring it back down to your dai mai. So here's my dai mai here. And now my body turns. The hand follows around my dai mai. Now as I'm doing that outside, it leads the chi to move that way inside. And now I expand back outward. And I turn again. And then now I relax. Allow my hands to come in. So that teaches you to relax. And now slowly turn your waist. So don't move your arms. Your dantian and waist turn. And now you expand. How do you expand? You sink into the ground to make it expand. Okay. And now as it comes in, of course, you sink. I stay in this position and I turn. My legs and knees are still bent. And now I push into the ground, expanding outward. So the movement expands in and out all the time. Okay, so that again utilizes the principle of Kai He, but also of yin and yang relationship between inside and outside. All right, let's follow Jack now doing the big Dai Mai Mo Pan Gong.
Big Dai Mai Mo Pao Gong. We're going to start again with our hands at chest level, and we'll do both directions. And I'll start by turning to the left. So we're turning to the left, drawing in to my Dai Mai, following that around as I turn back to the right, expanding up, pushing off the ground a little bit, and turning back to the left. Drawing in, following the belt meridian, expanding, and turning back. Again, motion's mostly coming from the waist. Keep your shoulders nice and relaxed and down.
Shifu Fong, you hear me?
Yes.
You need to take a 10 minutes break.
Okay, we'll do so as soon as we finish.
Okay.
All right, we'll do one more in this direction. Draw in, turn, expand, and return. And now we'll do the other action. Turn to the right, draw in, turn, expand. For your patients, it's good to have balance. Make sure they are practicing on both sides. I would say it's not any harder to learn both sides than it is to learn one side. Span and float your arms up. Make sure you're not lifting with your shoulders. Just expanding your arms up. And we'll do two more. And last one. Draw in. Feel your belt meridian. Expand up and return. Good. And that's big Dai Mai Mo Pao Gong.
All right, very good, Jack. So, just for some again a little background, my teacher Feng Jichang, one of his teachers was Hu Yaozhen. Hu Yaozhen is considered the father of modern Qigong. He laid down the basic principles for how Qigong should be practiced. And so the Qigong we're teaching you today is from that source, meaning incorporating the principles of Qigong, which can be different but can complement Tai Chi. And so Grandmaster Feng spent his time combining his study of Chen style with the study of Qigong. And many of his Qigong exercises are based on amalgamation of different things. I studied from him as well as from other people, and I began incorporating the other things that I've learned into what I teach. So these things illustrate the basic principles as I see it. So it might not be the only way, but this is certainly a way. And what I hope is that you've been following along to see if you have any feeling. So if you feel your hands warm up, or if your hands turn kind of a bright red, you have succeeded in actually moving your chi. Even more than that, if you could feel the energy coming up when we're doing it, that's even better. You can then feel the energy moving up from your legs through the head and back down. Those are essential if you want Tai Chi to actually work for healing. So, okay, if there are any questions, we'll take questions later. But yeah, we're going to take a 10-minute break right now, and we will be back shortly. Thank you very much. Back. Welcome back again, everyone. I hope you're still there. You haven't fallen asleep. Trying not to bore everybody. So two things I do want to mention. One is please try and follow along and actually do it yourself. Reason is if you feel it, then if you're gonna prescribe it to a patient, you'll know how it feels, and that's important. If you don't experience it yourself, it's whole lot of difficulty to make a patient follow you and do it if you have no faith in it yourself. So please make sure you follow along. And there will be lots of things that we'll be introducing, but like I said, we'll start with the 5 basic principles again. Every movement must have kai he, opening and closing. Kwai man, fast and slow. We're not going to do too much of that, okay? Yin yang. So every movement has to have yin yang. Also, nei wa, in and out have to inside and outside have to be moved together. Okay. Let's see. Have I forgotten something? Anyway, those principles all have to be there, but we can use different parts of those principles to make our techniques effective. Now, these techniques that I'm teaching, as again, the Sun ones have been curated already by Dr. Paul Lam. He had 15 years of clinical study to show that they work and they are evidence-based. So that's important to understand. A lot of what we're teaching has already been tested clinically and has been accepted by scientific journals and by the CDC as being effective, easy to learn, does not hurt your patient. And then the last thing that my teacher said is important, they're beautiful. Okay, he says it's ugly, nah, that's not good. So movement has to have those qualities. Oh, and the last one, of course, is it's evidence-based. So you cannot just prescribe anything, which is why like something like Yang 24 is not has of little therapeutic value because snake creeps down, the kicks have no value itself, especially if you're old and you can't do it. There's no reason to do something you cannot do, and you cannot effectively gain any benefit from its practice. So we're trying to develop and introduce techniques that have already been tested to follow the principles of both Qigong and Tai Chi. So they're a little bit different from what you may have normally thought of as Tai Chi practice. The first part of our practice today concentrated on Qigong practice, how to move the Qi. So for a patient who has cold hands, cold feet, any of the stuff we did in the first part of the program is important. Stiff limbs, stiff body, they have pain in different parts. All the stuff we did is excellent for that, okay? The second half of the program that we're doing today we'll be taking Tai Chi movements and practicing them as Qigong. Reason for that, these movements can lead to a form, especially if you have patients or friends or students who are somewhat more mobile. But what we do stationary is the first part you should start with. Too many students, even though they're hurt, try and do movement, and actually that won't help you heal. The healing works best when you're stationary, because then you have chance to concentrate on the movement of your qi rather than the movement itself. Okay, movement itself distracts you from actually feeling the energy and getting it to move. That's why all of what you're doing today basically is just standing still. All right. So the next set of things we're going to practice, these are Tai Chi movements, and particularly from the sun form that we'll reintroduce tomorrow. These movements are from the form, but done as Qigong practice. So they improve your circulation. It's a little more interesting to do. Requires, however, a little more coordination. So that's the other thing. What we did earlier, almost anybody can do. This part is a little more difficult. So again, you gauge what your patients can do, teach them what's appropriate. And so again, if you need to do it yourself, so you can figure out which ones you can use and what's appropriate for your patients. And again, most acupuncturists that I've asked who actually learn Tai Chi, which most of you have, almost nobody prescribes it to their students. So that's because it's something you learn, but you don't know how to apply it. So here we're trying to give you tools that break the Tai Chi down so you can actually use it for a particular situation. So again, opening and closing we did earlier, good for the lungs, good for your general circulation. But if you have asthma or emphysema, this is quite good for you. All right. Okay. So we're going to move on now to doing things that belong to Tai Chi. So one of the most basic ones is beginning Tai Chi. So I'm just going to mention this. Everyone who does Tai Chi does it this way. They come up and they go down. Okay. So that's how Tai Chi opening is normally begun. But that actually is a physical exercise, not an energetic exercise. So let me explain. When I raise, there's a peng energy that is expanding upward. So my hands are facing each other so that the low gong points face each other. That allows me to transmit energy between them. And now, from here, I rotate. The rotation, as I said, knits my fascia together, allows me to connect the qi to my arm. From here, I reach out as far as I can. And then from as far away as I can, draw the energy back toward me. And then as hands approach my legs, at the end, my fingers push down and I float myself up. So this uses 4 different energies of Tai Chi. This is Peng, Ji, Lu, and at the end, An. Okay? So Peng, Lu, Ji, An are the 4 basic energies of Tai Chi. And the first movement is actually the most important Tai Chi movement to do correctly. Because if you do it wrong, the rest of it doesn't really matter. Okay. And this has all the aspects of the Qigong we just mentioned. So as my arms raise, my body sinks. I connect my fascia and my legs expand. And I reach out, everything's connected. I send my mind, my yi, out as far as I can. And now I draw in. So this is Lü, or rolling back. Energy is coming in, and then I push the energy down to the ground. And so this facilitates the movement of your qi in a complete way. Okay, so let's practice that now with Jack. This is beginning Tai Chi. It is also called in Qigong, sink qi to the dantian. So if you like qi chang dantian, how do you do it? This exercise is to teach you how to qi chang dantian.
Sinking Tai Chi or sinking Chi to the Dantian or begin Tai Chi. So we're gonna start by raising the arms up, palms facing each other. So you've got a nice complete circle. rotating the hands to palms down, extending forward, sending your intent as far forward as you can. Then withdrawing. It's like you're painting your hands along a curved surface. And then release. Relax your hands and sink everything down into the ground, being very aware of the feeling of the bottom of your feet. And again, raise up. Just floating your hands up. Rotate and extend. Sink and draw in. And release. So as I raise up, my body's sinking a little bit, and my body raises up. My body sinks, and my body raises up. So you still have that second legs or your second heart activity going on at the same time. It's also common when you raise your hands that you'll lean back a little bit to try and counterbalance. Try to avoid that. Stay nice and straight and connected so that you can get a little bit better flow through your body. Yeah, we're raising up, hands facing each other, feeling like we're expanding, directing your intention forward, contracting, and then sinking and releasing into the ground. We'll go ahead and do 2 more. Raise your hands up. Extend. Paint down. And release. And last one. Good. That is begin Tai Chi or sing Chi to the Dante.
Excellent. So that is one way to practice using this movement to circulate your qi. So it uses, as I said, the 4 basic energies of Tai Chi to actually circulate the energy through your body. So you're, how should I say, bringing it up, sending it out, pulling it back, sending it down. And the process occurs over and over again. So the energy comes up, goes along your arms, go out, and then you draw it back all along the inside and sink it back down into the ground. So you circulate the qi through all the channels and meridians that you use in basic acupuncture. Okay, so that's why this is so powerful. Okay, and it's kind of different from the other way, which most forms begin. You're only circulating 2 energies, so the, if you like, the circuit is never actually complete. Okay, this way you complete all the circuitry throughout your body. All right. So now, having said that, there's a way to utilize this to help you feel your qi. You can do that just for yourself or with your patients. So here's what we're going to do. We're going to start here. You're going to raise your hand up and then extend it forward. Now, in the forward extended, all you're going to do is relax a little bit and then straighten your legs, send it out. Relax again. Send it out. Try and keep your shoulders down. Okay. See if you can feel your palm heat up. The heating up of your palm is evidence that your qi is moving. So again, let's follow Jack doing that.
We go ahead and raise our hands up. Extend forward. Just draw in a little bit and extend. Draw in, keeping the elbows low, the shoulders low, and extend, pushing from the feet. Sinking into the feet. And again, if you're new to the feeling of qi, Really focus on the sensation in your palms and fingers. It feels a little bit like a good amount of blood. So like very full of blood, a little bit of a tingling, almost as if you're holding some cotton. That's sort of the feeling you're going for. And then trying to extend that feeling through your body, all the way from your hands to your feet. Then we'll do 2 more. Sink all the way into your feet, push up, extend your hands. And last one. Sink and extend. Good.
So again, if you were following along, your hands actually should feel warm as the chi moves through it. And it's that kind of sensation that encourages the patient to actually continue the practice. If you cannot feel anything, as I said, of course, you can't prescribe it to use. So here we're giving you, again, some practical things that will allow the patient to actually feel the chi, and in the process of practicing it, begin to heal themselves. So again, this is very small movement. It's not big, but it utilizes what? It utilizes my legs as the second heart, but also because the body is rising and sinking all the time, the chi is moving up and down because of yin and yang. Okay, what goes down must come up. The body goes down, but the energy comes up. Okay, so that's a very interesting way of moving the energy through your body. And so that's essential. So if you just do this and you don't use the body, nothing happens. Your shoulder gets tired, your wrist gets tired. So if a patient complains when they're doing this, oh, I can't do it because my shoulder is hurting, it's because they're tense there. So you know that you need to help them relax their shoulders, whether it's through massage or acupuncture is another way to diagnose them. But when you're doing this, you're using your body. You're not using your shoulder. Your shoulder will not get tired at all. My whole body is supporting me. And so the weight of my arms doesn't actually impact here. The weight of my arms is distributed throughout my body. I feel nothing. So if you feel something when you're doing it, it's because your shoulders and back muscles are actually not relaxed. So the way actually for you yourself to gauge, are you actually sewn? This is one way to actually tell. If you do it and you feel tense, it's because you're not sewn actually. So oftentimes we think we are sewn, but we don't actually know how to feel it. This is designed to help you feel it. Okay. So we're going to do another one. This one is kind of similar. So you're going to come up here and then extend your arm out. And now you relax the knees again and then send the hand out, pushing up. Relax, sink everything toward the ground. As you extend, push off the ground, extend. Think about sending your chi out as far as you can and up. As I relax, I draw everything in, send it back out. Again, if your shoulder gets tired, it's because you're tense like that, but you relax. The arms are just sitting on your shoulders. They're not doing anything. Your legs are providing the power to move your hands. So in the end, it's the energy that moves your limbs, not your limbs. If you're using your limbs, you're engaging your muscle. Once you engage your muscle, the chi cannot flow along the channel or meridian. It slows down because the muscle expansion kind of taps against the channel and closes it off. All right, let's try and follow Jack. This is left and right. 左右推上, left and right to push the mountain.
Left and right to push the mountain. So we'll go ahead and raise our hands. Open up. So your hands are pointed outwards. And extend. And sink. Contract. And draw your hands in. Extend them back out. You may also feel a little bit of a stretch in your shoulder area. That's good. That means you're finding a new relaxed position beyond where your normal range of motion is, you will ideally get that stretched out so you can do it with no stretch afterwards, after a while. But again, you're sinking in and drawing everything in together, pushing it against the ground, and expanding everything out. My total, like vertical up and down travel, was only about an inch. Small motions of the body turning into slightly larger motions of the arms, but this is still a rather conservative amount of motion in this move. We'll go ahead and do two more. Sink in and draw in, push up, and expand out. And last one, sink in and push up. Good.
So again, the key here is to remember, if you're using muscle to do it, then it is purely a physical exercise and you're doing slow exercise, but you're not doing Tai Chi. Tai Chi requires you to connect to your entire body, use the energy inside of it to move. And that's what we're trying to do. And the movement requires you to engage the whole body. So you notice we're using the legs, the body to pump the chi. Everything is moving as I do it, even though most of the time you won't be able to tell if someone who's very accomplished, they can do it without seemingly moving anything outside because it's all inside, okay? So this method that we're teaching is to teach you to go from the outside rather to the inside for your movement. That's where the healing process occurs. It's not just in doing the outside movement. That kind of helps, but is not how the main effect of Tai Chi comes from. It's from the internal circulation, the ability to move energy that allows it to heal. Okay. So next one is a exercise from the form. So this is one that's pretty complicated. So we'll start with it this way. I'm going to have my right hand on top. So this is like when we were doing the Mo Pan Gong, but this time I'm doing the Mo Pan Gong with my hands on top. So this is my right hand. I go to the left, come back to the right, and now my right hand comes up, left hand comes up. As I rotate, I push forward to the left corner. Then I drop my left hand on top. I circle back to the right, back to the left. This hand comes up. I rotate, and again, I push out to the right corner. So this is Fair Lady Works Shuttles. Okay, so again, drop the hand on top, circle, come back, and push forward. Now, the thing about this movement too, when I come forward, many Tai Chi teachers teach you to do it this way. That is not how I'm moving. Okay, so as I come around, my hand comes up this way. I rotate outward horizontally, and then I push out. Okay, the result may look the same, but the way I've done it is completely different. So this uses the revolving energy of connecting your fascia. So my fascia connects, and you notice everything is turning, so I can connect the fascia as I'm doing it, which allow the chi to flow. The other thing this way is it takes all your pressure off your shoulder. If you have to lift it like in 24, the shoulder is invariably tight because you tried to lift your arm, okay? Instead, we just roll it outward. The shoulder is never engaged. You're still relaxed, allowing the chi to flow smoothly. All right, let's follow Jack. This is Fair Lady Work Shuttles.
All right, Fair Lady Work Shuttles. Then I'm going to start with my left hand palm up, right hand palm up on top of it. And I'm going to circle, turning to my left, drawing back in, turning to the right. Left hand is going to come up, rotate, walk outwards. Right hand is pushing across my body. And come back down, left hand on top. Circling to the right, drawing back into the left. Right hand blocks and rotates out. Left hand extends forward. And again, right hand on top. Circle. Push from the feet. Rotate the left hand out and the right hand across. Rotate. Again, rotation is coming from the waist. You should not be torquing your knees at all. So if you can't turn very far, this is perfectly fine. But if you can turn to 45 degrees, that is preferable. Circle. Come up. And push. Relax. Circle. Block to the side and push. Nice relaxed circle. Making sure to keep your shoulders relaxed as always. So my blocking hand is going to spiral out. So you have one hand being very circular and spiraling, the other one pushing more in a straight line. And we'll do 2 more on each side. Circle, rotate, push, circle, sinking my body, extending my body. Last set. Good. That was Fair Lady Works at Shuttles.
Okay, very good, Jack. So again, try these movements out for yourself. But again, these are good. Keep in mind, this particular exercise, you can do it with patients who are sitting in a wheelchair. So I'm going to sit down just for a moment. So I'm sitting in a chair. Again, you can still do the same movements even while seated, okay? Do not think that you have to stand up to do many of these Tai Chi movements. Many of what I've taught so far can be adapted for anyone in a wheelchair. So there are no other styles of Tai Chi. You can actually do it easily in a wheelchair. The Sun style Tai Chi movements can be adapted for any situation and actually for a patient with almost any kind of illness or problem. Okay. All right. And again, it's because we're trying to circulate the chi, not work on complicated moves. The simpler they are, the easier it is for the chi to flow. But then again, you try to incorporate the whole body. So the next one we're going to practice is Ausilo no bu, which is the brush knee and press. But I'm not going to do it with any stepping for the moment. Okay, my feet are facing forward. So what I'm going to do is I'm going to sink on my right leg. As I sink on my right leg, my left hand comes up. Okay, so all my weight is on the right now. So I sunk. I turned to my right. The hand came up. I'm going to shift my weight to the left leg. The right hand drops. This hand comes up, and now I rotate my waist. And I push to the corner. So that's 45 degrees. Okay. My weight is now on this side. I sink again, dropping the hand, allowing the other hand to come up. And now I begin to rotate, push into the ground on this side. And as I push into the ground, I push forward and I push downward at the same time. You will also notice as I'm doing that the chest is rounding, the chest is hollowing, the back is rounding. The knees are actually bending at the same time. As I turn, my waist is leading the motion. At the end, when my weight goes to the left side, I sink into the ground, pushing forward, pushing downward, and you notice the whole body straightens back up again. When it straightens up, my body returns to Zhongding. The qi is able to separate and go up and down at the same time. So the circulation is complete. Again, you sink. As you drop, the hand comes up. I rotate my waist. I push into the ground again. And as I do that, the energy goes out and down. My body comes up. I return to Zhongding again. Okay. Make sure you have all those aspects. Otherwise, this movement just becomes, okay? You have to feel the sinking, the transfer of your weight, the expansion out, sinking again each time. All right, let's follow Jack again, doing now brush knee and press.
All right, brush knee and press. So we'll go ahead and start by sinking onto the right foot, raising the left hand, having it come to the side, raising the right hand slightly behind you, and turning to the left, sinking the weight into the left foot, and pressing with the right arm. So there's a little bit of intention, energy in my left hand. It's not just flopping by my side. All my weight is in my left side, and I'm pushing with my right hand. Yeah. Right hand comes in, left hand raises up. As my weight shifts into my right leg, my arm pushes across. You raise your hand, your back hand, block across your body, and push. Raise up, block across, and push. That block across is why this move is called brush knee and press. Because if you're in a lower stance, your hand will brush by your knee. It's also good for a patient's coordination and just doing the move properly. You can synchronize everything. So as I move and stop, when I stop, everything stops at the same time. So my weight finishes shifting from one side to the other. My lower arm finishes blocking to the side, and my upper arm finishes pushing at the same time. Having that body awareness is good for the patient. And we'll just do one more set, one more on each side. Raise up, push across the body and block out. Raise your left hand, push across the body and block out. Good. And that is brush knee and press.
All right. So again, try it yourself, see how it feels. And of course, the point of all this is that if the patient or student cannot feel it, they have less reason to continue practicing it or using it. And I think that's important because we were discussing at lunch, why do people continue to practice yoga and not Tai Chi? One is because they have a real sense of physical achievement. They can feel the difference and the changes in your body. So if we don't teach the patient how to engage the whole body, it would just be external movement and they won't feel any of the benefits of actually what Tai Chi will do. Because once you can feel the energy movement, your understanding and perspective on why you're doing it suddenly changes. So I hope that makes some sense. You have to physically continue to change the body as well as be able to circulate the energy. Then there's reason to incorporate it into your own practice and also for your patients and your patients to practice it themselves. All right. So all these movements today require that kind of concentration and focus. The next one is also a martial art movement, often done incorrectly. So Oftentimes people just kind of wave their arms. So the entire body has to move, except for your knees. Your hips can turn gently, but your knees cannot move as you're doing this. Also, the upper body and shoulders have to turn. So we're going to do a simple one from Sun Staff because there are many different ways of doing wave hand like clouds. This, however, is the easiest. This is like in Karate Kid, wipe on and wipe off. Think of a mirror in front of you, and you're going to polish it with the palm of your hand here, and then the other hand comes up and polishes it. Okay? But you'll note I'm not polishing it like this. That doesn't do anything. That's physical exercise, but it's not Tai Chi. Tai Chi requires you what? To move the entire body. So what happens? The dantian area, the lower core here, my core turns, which turns my upper body, which moves my shoulders, which eventually move my hand. So the movement is being controlled by entire body. Now, to get the proper feeling for Tai Chi, wave hand like clouds, you have to feel what? When I turn this way, there's force going down into my feet. The other side is emptying. And now I transfer the force to the other side, empty this side. Okay? So my legs are working like a piston as I turn. One side pushes down, the other side relaxes. Other side pushes down, and you relax. It is with that action that you actually engage the entire body. So to do wave hand like clouds, the connection has to be internal, not external. So if you just do it like this or like that, you're not doing anything. The connection has to be through your legs. You feel the leg pushing down, which turns your body. So you notice how I'm doing it. As I'm shifting my weight from leg to leg, my body is turning. So it's the internal part. So people ask me, what is Neigong about? How is it different? Neigong, I'm using my energy to move. If you're doing traditional or external Gong Fu, it's my muscles that are doing the movement. I have to tense my muscles. I have to stretch them. I have to turn my body. Tai Chi doesn't use that. Tai Chi is using merely the movement of my internal energy. And I'm moving it right now by shifting the energy, going up and down into my legs, which turns my body. Okay. All right, let's follow Jack doing wave hand like clouds. Yun shou.
I think this is probably going to be the last one we have time for. Let's go into wave hands like clouds. So I'll start with my left hand up, right hand at belt meridian level. And that lower hand is just going to follow belt meridian across. So you turn to each side. But when you get to one side, switch the hands. So one hand is going to be expanding outwards, and one hand is going to be contracting inwards. As you rotate, it's a very circular motion. So you can feel yourself sinking into your different legs, like Sifu Fong mentioned. So you can feel that connection. Earlier, we were pushing up from our legs and using that to lift our arms. Now we're doing that. We'll lift one arm while the other arm contracts. It's much more difficult to do correctly, but also much more rewarding once you get that expansion and contraction at the same time. And we'll do 2 more sets. So turning to the left, bring my arm up, switching hands, turning my waist to the right. Last set, shifting my weight, keeping my shoulders down. And that's waving hands like clouds.
Okay, very good, Jack. So let's raise your hands up and turn. Okay, turn it as quickly as you can. Now bring your hands together, but don't touch. Okay. So now slowly move them backwards and forwards, but don't touch. So see if you can feel something between your hands. Now don't try looking for it, try and feel it. Okay. So some students describe it as they feel the hands are kind of magnetic, or they can feel the hands kind of tingling. Okay. You feel any of those things, what you're feeling is your Wei Qi that surrounds your body. We have slowed you down enough and speeded up your Qi and your blood enough for you to actually feel your energy field itself. So that's what you're feeling. This is the energy field surrounding your body. And the stronger it is, the more you're able to fight illness and disease, and the healthier you will be. And now slowly turn. Again, try and see if you can feel the qi in the middle of your hand. Okay. Again, this is the low gong point. You should feel it in the middle of your hand. Okay. And now move it the other way. Yeah, very good. So Serena, I guess, says she feels it. Yeah, you can. This is not an imagined feeling. This is actually the healing power of Tai Chi. Okay. You're feeling the actual movement of energy. Through the practice that we have just done, you've been able to move your energy. You can now begin to feel it. So next, take your hands, try and separate it. Again, feel the expansion. Can you feel the energy between your hands? Right. It's pushing your hands apart. That is exactly correct. You can feel as the energy expands. That's the Peng energy. Peng. Pushing out. Lu coming back. The energy collapsing. So again, relax. So that is actually very important. When I first went to China to study with my teacher, Feng Jichang, this is in 1980. And I was one of the first ones to go to China to study. I asked him, what's Qi? And he said, okay, when we finish your Qigong exercise, I'm going to show you something. This is what he showed me. And when I finished it, I go, okay, so there's something here other than just physical mechanics. And this is the part that's amazing about Tai Chi. You're actually moving energy. That's how it heals. It's not because of the movement. So it doesn't matter whether you know 108 moves, 24, none of that matters. A few movements are all you need to improve health and wellness. And if you can prescribe ones that actually work, your patients will improve. So the movements I'm introducing have been tested already. That's why we're teaching them. We know that they have results.
Shifu Fang,
Yeah,
time
to you.
is up, and the students have learned today something, but tomorrow there's 3 hours of Shifu Fang's class. You're welcome to come back. Okay, so in 5 minutes, next session will start. Thank you, Shifu Fang.
Okay, so I should mention the next session we will work on teaching a form, how to put this together. So if you're interested in that, that's what we're going to be doing in the next session. Going from the practice here, how do you teach a form? Again,
Yep.
a form that is healthy for the student, not for performance. Okay, so that's all.
That's for tomorrow. Okay, that's tomorrow. Yes.
That's tomorrow.
Okay. All right.